Hi, I'm Verna, Executive Director of Finney County Community Health Coalition. I think that we have learned that we really need to involve the community. As we go about any parts of our programming through the coalition, we ask the community what the needs are, we identify those needs, and then we're very good at listening to what that community says and identifying projects that will meet their needs and fill the gaps that they've identified.
I'm Smink, the Executive Director of Mission and Ministry at St. Catherine Hospital in Garden City, Kansas. We at St. Catherine's are very proud of our Community Health Coalition, which oversees our grants. Our violence prevention initiative came from the community. They asked us, we need to deal with domestic violence. And so because of that, with all the different focus groups, we had an implementation program, and then we started working with the different groups. Because of that, we discovered that there was 2 or 3 areas that are predominantly hot areas, we call them, where domestic violence is in Garden City. And what we did was we decided we would go to them. We rented an apartment and we call it a community educational center, and there we start working with the community, the residents, mainly immigrants from the Burmese, Hispanic, and the Somali communities.
The progress that we've made has been exemplary, I think, as we go about planning for projects right in the Neighborhood Learning Center. We've involved other community agencies also. We have held a summer school last summer, and of the 53 children that attended, not one child fell behind from spring to fall in their reading literacy. We also have been working with local law enforcement to do training for parents and for the children. As we go about that process, the same lesson is taught for the children and for the adults, and then we bring them together to talk about what they've learned. There are other things that we're doing in the community. We're working on a community health worker model with one of our local pediatricians. This project also will go right into the community. We've learned that we really need to involve people who have a high credibility in the community. They must be respected. We always have to have the interpreters that are well respected and great interpreters. I think for our tips, that we really understand that we must ask the community what the needs are, and then we need to listen to what they tell us. If we need to make adjustments, we can go ahead and do that. But our community is a community long-standing, known for its collaboration. And so as we go about that process, we really do involve the whole community.
And that's especially with different leaders. We make sure we have leaders from the different ethnic groups that are recognized as leaders that participate in our program. And they're very active in the educational processes. We've also been able to translate different community documents for them so they know where to go. Because we really believe if we increase safety, we also increase health. And that's why it's even moving into another area that this would be a community health center also.